Hello everybody, this is Kumar Mohit. I'm a student of medicine here at University of Perpetual Health System Delta, Jonelda Foundation School of Medicine in Philippines. So today I'm going to demonstrate you how to examine our motor functions of our body. Okay, so what you have to make sure while we will start this video with the observation. We have to observe the muscle tone. We have to just go for the checking the strength of the muscles of the upper extremities and the lower extremities of our patient. With that, we have to also observe is there any kind of the improper movement or the involuntary movements in the hand or the leg. So let's go and start this video. So first of all, what we have to do in the starting of the examination, we have to observe our patient's upper extremity and the lower extremities closely, and we have to find out is there any kind of the deformities, visible deformities, or is there any kind of the atrophy or the any skin deformity. So we have to just look at that all things properly, and we have to make sure, we have to find out is there any kind of the tremors on the hand or any other movements or any other involuntary movements. Okay, so we have to find out, we have to check it properly. And as we know, the atrophy are the any kind of the flat muscle or any kind of the concave muscles on the hand or the leg. So these are the type of the atrophy of the muscle. So we have to observe that properly. And for the atrophy, we used to give priority to see on the shoulders properly. For the atrophy, we have to check the shoulder, both shoulders, and then we have to check the hands as well for the atrophy. Is there any kind of the atrophy in the hand and the shoulder? Then we have to also observe these muscles, quadriceps muscles of the, will you please do it like this, this thigh, because that might be chance of atrophy in generally in old people, in more age people, there are the chance of atrophy in these muscles. So we have to check the thigh as well. Okay, we have to also observe the contour of the muscle and the any involuntary movement in the muscles at the time of the inspection. And for the atrophy, we have to also observe that atrophy may be proximal or distal, so we have to observe it properly. Now we are going on the next step, that's we have to just check the free motion. So you have to just relax your body. Okay, let me do the flexion and the extension. So if you feel any difficulty, please tell me. Okay, we have to check that movement properly for the wrist as well, flexion and the extension. We have to make sure that we have to hear it properly. Is there any kind of the abnormal sound or any kind of the jerky movement while doing this? Okay, that should be completely relaxed. So that was for the upper extremities. We have to do this free movement for the lower extremities as well. So let's go for that. So will you please lie down? We have to make sure that while we are just checking the lower extremities and the movements, then supine position is the best position for the checking that. Check the proper movement, proper. Okay, now you just relax. Okay, we have to flex it, flex the hip joint and flex the knee joint. We have to make sure that if any kind of the restricted motion or any kind of the different sound we are able to hear, then we have to just especially go for that part in detail. We have done with the muscle tone, and we have checked the muscle atrophy and that all. Now we are going to check for the muscle strength. So what we have to do, we have to put some resistance across the motion of the muscles like biceps and triceps, and then we have to tell our patient that they will just try to do the motion and we will register it. Okay, so or they just hold that proper position and we will try to deform that position. Okay, so we have to go for that. This is the muscle strength. So muscle strength we just measure with the help of the muscle strength chart or with the help of the muscle strength index. Proper voluntary and the involuntary movements of the muscles with the restrictions as well. Okay, they are bear the restrictions as well. Okay, so that's for the muscle strength. So let's go and do the muscle strength for the upper and lower extremities both. You have to make position like this. Okay, now what I'm gonna do, I'm gonna to just make it down and you have to restrict it. Okay, you have to hold it like this. So this one for the biceps of this hand. Now for the triceps, what you have to do, you have to just put it like this, and I'm gonna press it inward and you have to register it. Okay, this one for the triceps, so we have to check this in both hand. Okay, now we are going to do for the wrist. You have to do it like this. Make sure you have to do it like this. Okay, now for the flexion one, we have to just try to put it down and you have to register it. Okay, okay, this one is for the flexion, wrist flexion. Now for the wrist extension, you have to put it down. I'm gonna try to put it up and you have to register it. Okay, we have to make sure we have to do that same thing on other hand as well. Okay, now we are gonna do the another test, that's the hand grip test. We have to just give our 2 fingers of each hand, like index finger and this finger, to our patients, and please hold it tightly and squeeze it and don't let me get back. Okay, so that strength should be there in the palm and in the hand so that they can hold it properly. Okay, now next one is for the finger abduction and the finger adduction test. What you have to do, you have to just make it sure, do it like this, and I'm gonna press it like this and you have to resist it. Okay, resist it tight. Okay, for this one, for thumb, resist it. Okay, now we are going for the lower extremities, so will you please lie down. For the lower extremities muscle strength test, what we have to do, we have to first check the normal strength of the muscle. Will you please raise your legs like this, up. Okay, another one. Okay, make it down. Now what we have to do, you have to raise your one leg and I'm gonna put some pressure over here. You have to hold it. Okay, okay, down for that one. Okay, down. Now what I'm gonna do, I'm gonna restrict here. You have to make it down. Okay, I'm gonna. Okay, these are the movements which are strength related to the hip muscles, means the gluteal muscles and the muscles of the thigh as well. So this one, make it down. Okay, these are for the strength of this hip muscles. Now I'm gonna do the next one. This is for the hip muscles abduction or the adduction. So what we have to do for the abduction, we have to just put our both hands on the knee, and what you have to do, you have to stretch means outward. Okay, okay, go for it. That's good one. Now for the adduction, so what we have to do for the adduction, please a little bit. Okay, now I have to just put it inward, means the medial side of the knee, and then register it. Okay, that's a good one. So as we have seen, our patient is able to just do it properly, so that's the fine movement. Now here, I'm gonna push it down, you have to lift, try to lift it up. This is for the flexion. Now for the extension, you have to put it like this, relax, and you have to put it down. Okay, this one as well, for the first one for the flexion. Okay, good one. Now for the extension. Okay, good one. Now what we have to do, we have to do the flexion of the hip and the flexion of the knee as well, like this. Okay, Now I'm gonna put some pressure over here. Okay, you have to lift it up. Do it. Okay, this one. That movement might be a little strong because the quadricep muscles of the thigh, these are the strong muscles, so we have to ready for that while we are registering the movement. Okay, so that was the strength test for the upper and the lower extremities muscles. So now we have done with the almost all demonstration what we have to do for the motor functions, checking the motor system of our body. We have tried to do the flexion, extension of the knee, of the hip joint and the hip muscles, for the biceps and the triceps as well, and then for the wrist. So that all for the motor system examination. Thank you for watching.